954-753-8080. 954-753-8080. And have her review your Medicare plan. 954-753-8080.
Talk health. Talk wealth. Talk politics. Talk 1470 and 95.3 FM. WNN.
Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we are teaching you how to live a longer and healthier life. I'm Laurina Anderson. I am your host for this evening, and you can find us here every Tuesday evening between the hours of 6 and 7 on 1470 AM and 95.3 FM. We're also streaming live on Facebook fan page for All County Healthcare and also wwnnradio.com. We're being presented by Amp2 TV and proudly sponsored by All County Healthcare. They are a Medicare-funded, Medicare home health agency. And if you have any questions whatsoever about your Medicare home health advantages, please give Maddie a call. The telephone number is 888-717-7170. Every week, we bring on doctors to help inform you and educate you on your medical matters. And tonight is not any different. If you have any questions whatsoever for our doctors, please give us a call here at the station. The telephone number is 888-565-1470. We would love to answer any of your questions. We have a spine surgeon on this evening, and I would like to welcome Dr. Lazar. It's wonderful to have you here. And tell us a little bit about yourself.
Well, certainly. Thank you for having me. It's a pleasure to be here with you, Laurina. And I was in practice in the Rochester, New York area for 26 years before retiring in November of 2015. I then decided to come out of retirement, and I joined a very exciting young practice with Dr. Ben Myers, who is has a spine solutions practice in Hollywood and in Boca Raton.
Oh, okay.
What I bring to the practice that I think is makes us rather unique is minimally invasive is a catchword for a lot of people today. They want to do things outpatient, minimally invasively, but not all spine conditions lend themselves to that kind of an approach. And I kind of bookend the practice where I do the things which Dr. Myers, the minimally invasive specialist, refers to me or from other places that don't lend themselves so well to that. And so I think we really have a very comprehensive approach to managing all versions of spine problems. And it's very exciting to be doing this.
That is wonderful. Well, I can't thank you enough for being on the show because I do know how busy you are, and I also know that somebody had to pull your leg a little bit to get you to come on. But it is wonderful because we have a lot of people, especially in our demographics here and our audience, that need to hear more about what's available for the care of the spine and the various things that they deal with. Because you're right, not everything can be minimally invasive. Where you can just go in and tweak a little thing here and a little thing there. There are some other areas that will need, more extensive surgery in order for them to heal or get better and be able to function.
Absolutely correct. And growing up through the revolution of spine care over the last 30 years, it's remarkable to see what changes have taken place and what equipment have become available for us. Certainly with minimally invasive spine surgery, it's not just doing a little teeny microdiscectomy. Major reconstructive surgery can be done through minimally invasive techniques. And that's pretty much how my partner, Dr. Myers, was trained. My experience is mostly in some of the more complex cases. Now, everyone, when they have a spine problem that requires surgery, considers their problem to be complex, I'm sure. But there are certain circumstances, such as with someone who's had a failed surgery or a failed fusion or a complex problem which never got better despite multiple efforts. That's the kind of thing I like to see.
Oh, okay. So that's really what you specialize on.
That's correct. So I like, for me, it's more interesting to do cases like that. And we were discussing earlier about being old-fashioned. Old-fashioned for me is seeing patients, a lower volume of patients that have more complex problems from the standpoint of they've had more years of problems, or they're an older population, or they have severe stenosis or degenerative disorders and scoliosis, for example, that has become a problem. And doing a full, thorough history, a full physical exam of the relevant areas, then looking at MRI scans and making a judgment takes a lot of time. And the era of treating an MRI scan, I think, is unfortunate because it leads to unnecessary surgery. All of us have abnormal MRI scans from time, and so it's very important to keep it in proper perspective. And so if someone, and since living in South Florida, almost everyone I've come across has said, "Oh, I have a herniated disc." And it's a meaningless thing because almost everybody has one, and it's almost never a relevant concern. Many times, of course, the majority of patients who have back surgery, of course, have significant disc pathology.
Right.
But it's important to realize that people do fine without surgery most of the time.
Oh, and I know that you would be the first one to say, "Listen, you don't need me."
Exactly.
Don't worry about this. We can deal with this in another way. We don't have to totally open you up.
And with the one thing about Florida versus New York, where I practiced before, is that people can go to physical therapists. They can really get a lot of the non-surgical treatment without even having to see an MD or a DO. They can go to chiropractic care. They can go to physical therapists. They don't need a prescription for that. And when I see patients that really have failed all of these things and they're really at their wits' end to get some relief, and their diagnostic studies support some sort of a surgical procedure, it can be so gratifying to get those people functioning again.
Oh my God, I bet you. And they're probably so thrilled because you're their last resort. They have no other choice.
And many times that's the case. I've seen a number of patients that have been operated on that didn't even know that they had a failed fusion until I did the workup that showed that they had that. And so when you are
is it because they were so used to the pain that it never occurred to them that it wasn't normal?
Well, spinal fusion surgery, whether it's in your cervical spine, which is your neck, or your lower back, is pretty much what we do. We do a lot of that. Obviously, simple disc surgery and microdisc surgery is a part of it as well. But with spinal fusion surgery, achieving the goal, the objective of stabilizing a damaged section of your spine is the goal. And if you don't achieve it, you're going to have a problem. Instrumentation, the rods and screws that we use, all these various sophisticated implants. When I first started in practice, there were 2 different types of implants. Now there's over 150.
Wow.
So the number of devices and tools that we have are great. But the bottom line is you have to have a biological result. You have to have healing of the fusion, bridging living bone to stabilize a segment of the spine. And if it doesn't happen, implants will loosen, implants will become a liability. And unless you follow patients closely long enough to be sure that they achieve those objectives, you can have results that are not satisfactory. And so, not that I'm suggesting that my colleagues don't follow their patients sufficiently, but there are patients that slip through the cracks, or they felt fine for a while, and then the problems became a bigger issue, or they developed deformity above their prior surgery. So there's multiple places where a more traditional, more larger exposure type of surgery is appropriate in the lower back.
Yes, absolutely, and I can understand that. I've had many a friend who had been dealing with some really serious back injury. There was a tumor on his spine. He didn't even know about it, and then ended up having to go in for emergency surgery. Had a very reputable surgeon and everything, but unfortunately, I think that he decided to go back, and he didn't allow it to heal properly. And after a year, he still was dealing with a lot of pain and ended up finally going back in. And today, thank goodness, he's doing great. But I mean, he ended up having that same kind of surgery that you're speaking about, that you are specialized in.
There is no question that helping a patient that's in that situation is so gratifying. I had an 80-year-old gentleman who had 6 prior surgeries, including multiple efforts at achieving a fusion. And so I revised the surgery. It took about 6 or 7 hours. It was more complex. It was a more open procedure. And when he fused and his pain was tremendously reduced, and he no longer needs the walker, no longer needs a cane, it is just so exciting for that family and for me.
Well, you know something, and I think that's what's so unique about you as well, because we were speaking a little bit earlier, is that, you retired after 27 years and came back down here, and that was in, 2015?
Correct, and I missed it. I missed being taking care of patients, and I missed being in surgery.
You got bored, and that's what's so great about you coming back into the system and having your private practice again, because you don't have to do this, but you love what you do. You've got such a passion.
I do. I love taking care of patients that have really been through the ringer. They tried everything, and they just need one more serious effort to control their problems. And being the yin to Dr. Myers-Yang, where he does these minimally invasive procedures, and I take care of things that either he doesn't want to take care of, or comes my way because it's a little bit different type of a procedure and needs a more open exposure. I'm right there to do that. And I'm not looking to do a high volume practice. A practice like mine, which is more difficult cases, often it's one. I'm not looking to do high volume. I'm looking to just see specialized, limited, difficult patients are what I'm really looking to see.
Oh my goodness. You must be an angel for them. That's all I've got to say, because I do know that if something's bothering your back, it affects your entire life. Your emotions, your mental state, your attitudes, the decisions that you make, everything revolves around that, because it's your back that doesn't allow anything else to move.
You are so absolutely correct. In my practice up north, I took care of a lot of younger people, workers' compensation patients, people in their 40s. It disrupts their livelihood. It disrupts their lives. It disrupts their marriages. Their families are devastated. People lose their homes. It's incredibly, they're in crisis when they have a back injury in their 40s. Wow. Similarly, patients that are in their 60s, 70s, even their low 80s, if they're healthy otherwise, but they don't want to live if they can't walk, don't want to live if they can't function.
Yes.
And that group of patients, which I'm seeing more of, are even more grateful for something that can be done for them.
And you know something? We are going to get right back. We're going to go to a commercial at the moment. Stay tuned. Don't leave. We've got some more great questions and interviews here with our Dr. Laser.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor. I'm Laurina Anderson, your host, and we're going to continue this conversation with Dr. Lasser. There we go. And concerning spinal injuries, spinal deformities, the big surgeries, the big spinal surgeries. He's our spine surgeon this evening. So one of the things that I wanted to go back and talk about is your schooling. Where did you end up doing your schooling at?
Well, I grew up in Rochester, New York, one of the suburbs, and my goal was always to go to the University of Rochester School of Medicine, which is a really outstanding institution. And so I graduated from the University of Rochester in 1982 and did my residency at the University of Buffalo and orthopedics.
Okay.
And you were asking me earlier about who influenced me in my decision
Yes,
to choose
because
spine
you're
surgery.
so passionate. I love it.
My earliest experience with spine surgery was with Dr. Edward Simmons, who was a internationally known spine surgeon who had moved to Buffalo from Toronto, where he was chairman of the Toronto East General Hospital, and an internationally acclaimed spine surgeon. We were so fortunate to have him in Buffalo.
Wow.
And I just loved every part of it. I loved being in the operating room with him. He was very, very, very generous to me, and pretty much got me launched in the career that I chose. One thing about from 1988, when I finished my residency, things have changed so much in the last 30 years. It's unbelievable.
Yeah, I was going to say, well, you did say that, back then there were only 2 implants that you could use, and today you've got 150 implants.
Yeah. Biologically, there's a lot of things that have changed. And when I mentioned earlier about spinal fusion being the important endpoint of some of these surgeries that we do, there are some newer technologies that are kind of interesting, including materials that allow bone to grow into them, little porous devices made out of metal, like titanium and titanium alloys that act very much like bone itself. So you don't even need to have a solid fusion if you get some bony ingrowth into these devices, and they will not fail because they can cycle for equal to like 50 or 60 years of normal function. So, the need for a biological fusion is beginning to diminish, and we're finding other implants that are changing that. So the biologic materials that we use, the various metal alloys that we use, is changing a lot the way we do spine surgery. It's really quite remarkable.
That is remarkable. And so that's part of the state-of-the-art new technology that's coming out, huh?
And that's probably what the what's been very interesting for me is from 2015 even to 2017, some of the newer products that are on the market have made it much more interesting. Although I must say, I went to a spine meeting, a very well-known spine society called the Cervical Spine Research Society. They're actually having a meeting in November in Hollywood, Florida. But I found that really haven't learned that much in the last few years. It's by being in practice for 30 years and being engaged with patients, you learn a lot by being involved in the field.
Yes, yeah, absolutely. And then going back and doing a lot of schooling too, correct?
Well, initially, for sure. Mm-hmm. I did my fellowship at the University of Texas in Houston.
Oh, okay.
And that was at MD Anderson at Memorial Hermann. It's a tremendous place to go for a fellowship.
Wow. Well, we're lucky to have you here. And not only that, but the fact that you're so passionate about what you do. And that's what I was saying. You don't have to do this. You love to do this. And I love doctors who love what they're doing because the energy is so much different. The attitude, the way that you want to help. And, we were talking about the 70 and 80-year-olds, and you happen to be their last resort.
Well, many times it's true. They've either been turned away elsewhere or they've had incomplete resolutions from other surgeries. And so it is nice to see people that might have an opportunity to get better with a different approach.
Yes, absolutely. Well, and the other thing too, though, I was saying is, you get into the 70s and the 80s and they've tried everything. Sometimes it's so hard for them to pick up the phone again and try one more doctor because they've gone through so many.
I'm sure that's true.
So listen, by all means, please tell our audience how to get a hold of you.
Certainly. It's on the screen. Our phone number is 954-983-3888. And our office is at 2499 Glades Road, Suite 113 in Boca Raton. And that office is on the corner of St. Andrews and Glade.
Okay.
And it's easy to get to. It's not far from 95.
And if you have any questions right now, you can call into the station, 888-565-1470. And just in case you can't call in right now, you can always call Maddie at All County Healthcare. That telephone number is 888-717-7170. And just ask her that you'd like to get a hold of the doctor, and she can put you in touch.
And it's very important that patients understand that we don't just do surgery. Our goal is to see patients. Obviously, we are spine surgeons, but patients have to understand their diagnosis. They have to understand their options. And one thing about being in South Florida as opposed to upstate New York, we have more swimming pools, more availability for doing exercise programs and things that can be very effective in avoiding surgery. And as opposed to, I'm sure many of my colleagues, we really try to pursue everything non-surgically as much as we can. So if someone comes to us with the label needs surgery, we'll see about that. Because we really like to use all the adjunctive assets we have in the community, which are numerous.
Absolutely. I mean, that's what makes South Florida so nice, is that there is so much available and it's year-round.
That's right. That's right. Between pain management and the various physical therapists and, of course, our chiropractic colleagues, it's wonderful to have all this available, because if someone can get better through any avenue other than surgery, they should pursue that. And that often means getting their core strength better, getting the weight off, quitting smoking, all the things we know will reduce someone's back pain.
Right.
And people that do all the right things can very often avoid surgery, even with a really nasty-looking X-ray and an MRI scan, because you don't treat the MRI or the X-ray, you treat how the patient's doing.
Yes.
And being positive and being supportive and not scaring someone into thinking that they need to have an operation is just, I do see a bit of unnecessary spine surgery.
And I was going to ask you about that too, whether or not you have seen some patients that really didn't need surgery.
Well, I mean, when I first started in practice, there really weren't that many spine surgeons, and there are so many now. I mean, I can't say that upstate New York is any less guilty of what appears to be an awful lot of spine surgery being performed, but it seems that people have to take some responsibility for themselves to begin with.
Absolutely.
And if you're living a lifestyle that is just guaranteed to aggravate a back problem, you're not going to get better, and you can't expect us to fix it.
Yes.
But if someone really is committed to trying to pursue a non-surgical course, we can help them, we can reassure them, we can give them the tools. Similarly, if they've tried everything possible and surgery becomes appropriate, I think that we do a really good job.
Oh, that's great to know. So prevention is the key. Really, my audience, my listeners out there, please take care of yourself. Do the things that are necessary for your own health, because there's only so much that the surgeon can do. There's only so much that doctors can do. You really have to take responsibility for your own health and well-being.
Absolutely. And that's not always the easiest thing to do. I mean, there's, I think we're seeing less problems with smoking, but we are certainly seeing a problem with obesity.
Yes.
And it's a very difficult problem to take care of.
It is, yes, absolutely.
But a non-smoker who is physically fit rarely ends up with a back fusion.
Wow. And talk to us a little bit also, there's a lot of professions that are out there that, it's hard, intense labor, and they end up with back issues. Is there something that they can do to help themselves as well?
Well, absolutely. I've seen a lot of like nurses' aides, people that are in the healthcare field that have to lift patients, nurses and so forth. Learning, doing it with proper technique. One thing I've really been surprised over 30 years is how people who work for moving companies rarely see them.
Really?
You would think that if you're moving furniture, you would be
I was just
a
going
high
to say,
risk.
yes, absolutely.
It's really something. Usually it's someone that has lifted something that they shouldn't have lifted, or they did something that they shouldn't have done in a way that was perhaps excessively stressful. Mm-hmm. But if you know how to do proper technique at lifting and you do your job with proper education, you can really reduce the risk of spine problems.
I've watched many a mover.
It's amazing.
They're really amazing, yes. And a lot of times all they need is a rope. And they can pick things up. They just
they
wrap
know how
around.
to do. They know how to do it.
They do, and they squat. That's don't
right.
bend over. No bending over when you're picking up things. Squat to get the item. Correct?
That's right. Absolutely.
What other good prevention ideas do you have for our audience?
Good prevention. I think that it's very important to maintain good core strength. And I've got many of us have weight issues and so forth, but maintaining good core strength, which is your abdominal muscles, your rectus muscles, getting into a plank position or doing some partial crunches, learning how to do proper trunk exercises to stabilize your spine, really protects degenerative segments, damaged segments, things that were painful. So I've seen many, many times when patients improve their core strength, improve their trunk strength, pain goes away. And the same thing is true with the cervical spine. If you have a little bit of neck pain, a little stiffness, a little soreness, there are some isometric exercises that are very helpful to reduce pain. And there's so many ways of avoiding these things. But when you have degenerative disease or degenerative discs, it's not a time to lament that you need something done to fix it. It's time to get yourself in better physical shape, because the secondary muscle strength, the various supportive structures that you can strengthen will make all the difference.
Wow, that's very good to know. And I totally agree. I've also known a couple of people that have had cervical surgery, and they've gone in through the neck.
Oh yeah, we do that all the time.
And I'm like, oh my goodness gracious. Oh, yes. And
it's a remarkable technology.
It's a remarkable, yes, absolutely.
And it's easy for us to do. Of all the surgeries that we do, the disc surgery on the cervical spine in your neck actually is among the most successful and best tolerated by patients.
Wow. Well, that is super. I can't thank you enough for coming and educating us, giving us all the knowledge about, what's happening out there in the field, in the medical field, when it comes to the spinal surgeries, and also the prevention that you also end up sharing with your patients. We really do, we need to have that prevention put into place.
Absolutely. And a pleasure to be here.
Oh, it's a pleasure to have you. How do they get a hold of you again, please?
Through my office at 954-983-3888.
Okay, and you're located?
At Glades Road, and it's 2499 Glades Road, Boca Raton, corner of St. Andrews and Glades Road.
Thank you so much, Dr. Lasser.
My pleasure.
It is a pleasure to have you. And if you have any questions for him, you can't get a hold of him here, just call Maddie. She'd love to put you guys in contact. So we're going to break for a commercial. Stay tuned. We have another doctor coming right up.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor, where we're teaching you how to live a healthier and a longer life. And we're being presented by AMP2 TV and proudly sponsored by All County Healthcare. That is a Medicare home health agency. So if you have any questions whatsoever about your Medicare home health, please give Maddie a call at 888-717-7170. And if you have any questions for our doctor this evening, Dr. Brody, you can call in at 888-565-1470. We would love to answer any of your questions. Our topic tonight is going to be about Alzheimer's. So welcome, Dr. Brody. Thank you very, very much for coming and being a part of this. I do understand how busy you are, so I really do appreciate you coming in to help educate our listeners. So welcome. It's great having you. Tell us a little bit about your background. Where did you come from?
Yeah, I'm from Calgary, which probably you guessed, yeah.
Right.
So so Calgary's in Canada, in Alberta.
Yes, yes.
So, people from New York go, where? Well, let me just tell you, if there's a New Yorker walking down downtown Calgary and they say, I'm from New York, we all go, I've heard of it.
Yeah, exactly. New York? Where's that?
It's a small hamlet in the Northeast somewhere.
Yeah, yes.
So I'm raised there. I went out Eastern Canada to do my undergraduate and then back to Calgary for med school. Mm-hmm. And then I started out on my way to plastic surgery like my uncle, and that wasn't my deal.
Okay.
So then I did neurology at UCLA and then UCSD in San Diego. I'm a stroke neurocritical care specialist.
My goodness.
And then
wow.
I turned to do Alzheimer's about 10, 12 years ago. And I do Alzheimer's research.
You do. Now, what created that passion to do the research for Alzheimer's?
Well, my dad has Alzheimer's, and when I originally came to Florida, if you were a fisherman, you go to a stock pond. So as a stroke guy, this was a stock pond.
I see.
It's even more stocked for Alzheimer's.
Yes. Yeah, it does seem to be quite rampant. Now, is that because of the age and everybody coming down to, get out of the cold?
There's a few reasons. The biggest risk factor is age. Mm-hmm. We're better at making a diagnosis. People aren't falling over from other things. So that combination and the fact that there's just so many people here. In Palm Beach County, there's 1.2 million people. 52% are over age 65. there was 55,000 diagnosed cases of Alzheimer's in 2015.
55,000?
Probably at least another 20 to 30,000 that haven't been diagnosed.
Oh, my goodness.
Wear a seatbelt, have airbags.
Yes, absolutely. So how long does it take before you can make that diagnosis, before somebody really starts realizing that there's something going on here that's not right?
Yeah. On average, a diagnosis is made anywhere from 2 to 3 years after symptoms begin.
Wow.
But now we're pretty good at picking people up when they have a puff of smoke and saying, you really have a brush fire starting. This isn't normal brain aging.
Wow.
And that's what's led to the research, because the sooner we get people, the better chance we have to put people in remission. So there's two big things. Can we find people early?
Okay.
And could we put them in remission? Can we find people who are at risk but haven't developed symptoms and treat them then? And the Holy Grail would be, and they never know what they missed.
Wow.
So,
well, that really sounds...
We're there now.
We are. Mm-hmm. I'm loving to hear that, because I do have some very close relatives that are dealing with it at the moment. And the other thing also that I've heard, and I don't know if the numbers are growing, but early onset Alzheimer's.
Right. So Alzheimer's disease is not really one disease. It's a syndrome.
Right.
There's probably 5 or 6 different specific pathophysiologic versions of it. And early onset disease before age 60, and very early onset in the early 50s, is a highly genetically driven disease. So you're making too much of these abnormal proteins, one's called amyloid.
Okay.
And so people who are in their mid-70s, early 80s, they have a mishmash of things. They have high blood pressure and small strokes and diabetes. But these people are otherwise healthy. They're just churning out amyloid, and they can't clear it. And it's a more malignant course. People get it earlier. Their disease is more aggressive. They die earlier. It's bad disease.
Yeah, it is. Yeah. Yes,
it's
absolutely.
a different disease. But it's still under, we call them
it's still
under the
that umbrella.
Yeah, because we haven't really made a distinction yet.
Oh, okay. But are you beginning to make that distinction? I mean, it sounds as if there's a difference, and it's basically on the age premise. The younger the age, it's this particular,
right,
and the older the age, then
it's more mixed. So if most people ask me, well, where'd you get your hair done? No, most people say, what's the difference between dementia and Alzheimer's, right? Because they think it's different. So dementia is the category, right? So that means that you have trouble with your short-term memory and at least 2 of the other 5 cognitive spheres, which I'm going to tell you what that means in English. It means you have trouble with language, comprehension, getting the words out, visual spatial things like where do you leave your car, numbers, intellect, executive function or judgment.
Right.
And that you can't do all the things you used to do. And that whole mishmash is getting worse over time.
Right.
So under that umbrella, the most common type of dementia far and away is Alzheimer's type dementia, about 70 to 75%. So they're not necessarily 2 different things.
Right.
There's other kinds of dementia, like frontal temporal dementia, Parkinson's related dementia, vascular dementia, Lewy body variant dementia. But if you take the ones I just mentioned, that's about
25%.
Yeah, it's about 95% of the dementias. But the biggest one is Alzheimer's.
Right, right. And it seems as if, those numbers seem to be growing.
They're growing because of the demographics. Because we're all getting older. The baby boomers, I'm a baby boomer.
Yeah, I am too.
So, but here's the thing. By 85, almost 50% of people have Alzheimer's. This is not a rare disease. So when you start out at age 60, it's 3 or 4%, and every 5 years it doubles. So
every 3 to 5 years it doubles.
Yeah. So
because we're living longer?
Well, just because, we're getting older and we're not falling over from other things, and we're getting pretty good at picking it up early.
Okay.
That doesn't mean part of the problem is people aren't coming in.
Yeah.
Right?
Yes. Denial.
Well, a lot of even more people who are educated, friends of mine, or lawyers. I guess you could argue whether they're educated, but their dad. They said, "Well, I think my dad's having a little problem, but I went on the internet and they say there's not a treatment, so we don't really want to know." But the point is, you do want to know because there is something to do, and as like Yogi Berra said, it never happens till it does. So we're not going to have a breakthrough treatment till we do, and the only way we can get there is doing clinical research.
And that's what I was going to ask you about, because that happens to be your main specialty at this time, is doing that research. You have a private practice.
Yeah, I have.
Is it Brain Matters?
Yeah, Brain Matters Research.
Research, okay, yes.
The only people we see privately are people with dementia.
Gotcha.
So it's a relatively small practice, and the rest is research related to Alzheimer's. And, we have 11,000 square feet. We do phase 1 where people stay overnight, phase 2, proof of concept, phase 3. And we have studies everywhere from you have a family history and you don't have any symptoms, in prevention to moderate to severe Alzheimer's and everything in between.
Wow. So you're bringing them in, and there's various studies that you're doing with them. Can you talk to us a little bit about that?
We have a program called No in 90. So one of the big things is, well, I don't want to go there. What's the big deal? You can either call us or go online at brainmattersresearch.com. And we have a program where you make an appointment and you get an assessment, an evaluation over 90 minutes, and we can tell you, do you have an issue or not?
Okay.
And then you can decide from there what the next step would be.
That, something that's so good. I have gone on your website, and I had noticed that 90 minutes, and you can tell. I was looking at that and the various questions that you ask and how you begin to identify some of the areas that might be, in question.
Yeah, of concern, right?
Yes.
And so it's really enough to say there is an issue. This isn't normal brain aging. There's something going on, and then say, okay, here are the options. This is how we can go further.
So tell us about some of the options. What is coming out? Because we already know that there's no cure for this, correct?
There's no cure.
No. So what are some of the means that are coming up to extend life or extend their memory or extend?
Right. So I wrote a book about prevention of aging, stroke, and Alzheimer's.
Oh.
And since I'm a stroke specialist, there's a similar risk factors for Alzheimer's. High blood sugar, high cholesterol, diabetes, history of trauma, history of interactions with drugs. So what we look for is, always look for, is there something fixable that somebody's missed that mimics something like Alzheimer's? We always look for fixable things, and we find it 15 to 20% of the time. And we talk, what can you do to prevent aging, optimize aging, prevent having a stroke, and prevent getting Alzheimer's? And there's a lot of things you can do in the book. So
give us a few items, because I really want my audience to be able to hear, my listeners to hear this.
So simple things like exercise. So people who walk or swimmers, so as people get older, not you, of course, but as people get older, the hippocampus, which is the short-term memory relay station, starts to shrink. And as you get over 65, it will shrink 1.5% per year.
Well,
if you exercise,
it'll
actually plump up 0.5% per year. When you exercise,
I love that. I exercise all the time.
When you exercise, and it can be resistance training or aerobic training, you stimulate brain-derived nerve growth factor. So it's not like you exercise, it's better for you. It turns out that as you age, not you, of course, as you age, you actually make new brain cells. And so you can actually put fertilizer on that, when you exercise because the nerve growth factor in your brain gets stimulated.
That is very interesting. I love that. And yeah, I'm a bit of a baby boomer, my dear. So I'm doing a lot of things now that, just to anti-aging,
Right.
such as the exercising.
And
but
nutrition.
I didn't know that piece of it. That's very interesting.
So the Mediterranean diet has been effective for prevention and slowing the rate of progress. It's better if you live in the
What exactly is that? Just so that my audience can tap into that.
It's really mostly vegetable-based.
Okay.
Grains, the good olive oil.
Yes.
And that's kind of the bulk of it. And if you live in the Mediterranean and you play bocce ball and have a nap and you reduce your stress, it works much better.
I love that. Well, we're going.
Love bocce ball?
yeah, of course. I know a little. I love it, Italy as well. We're going to be right back. We're going to break for a commercial. Stay tuned. We've got more questions.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor. I'm here with Dr. Brody, and we're talking about Alzheimer's and prevention. And we left off with, first of all, exercise. And now we're going to start talking about nutrition. So please share with us about the nutritional needs to make the brain healthy.
So we talked about the Mediterranean diet.
Yes.
So there's evidence that helps slow progression and delay onset.
Okay.
And that diet's really about inflammation. So inflammation is part of the process of Alzheimer's and what actually starts to have the neurons, the brain cells, and the connections start to melt away. And that's really the problem. Over time, the connections, the synapses, start to actually dissolve. So diet can help. Exercise can help. Brain exercises where you're actually stimulating the brain and getting those networks of cell connections to be really robust. And we have a program at our center. It's called Mindset, where we actually show you techniques on how to help your memory and how to kind of use it and not lose it.
I see. Well, I did hear that, doing crossword puzzles, doing jumbles, doing anything that has to do with concentration allows more of the exercising to happen, and it's very healthy for the brain.
Yeah, it turns out that the things that really count are learning new things. And they have to be things that you're interested in. You could do Sudoku like homework, it doesn't really help you. But if you go to a lecture, if you go out with people and socialize, that makes a big difference. You don't want to be socially isolated. And so if you are learning new things and you're out interacting with people, those are big things to help.
Wow. That's very interesting, but I would think that would make such a big difference. Just the socialization piece, and being with other individuals, laughing, talking, having serious conversations, deep, serious conversations.
So I'll tell you a little story about a guy who was at a phase 1 trial. So he was there overnight, and I was there overnight with him, and he kept walking around the center. And, of course, he'd stop at the coffee machine, get a coffee, and it's 3 o'clock in the morning. And I said, Bart, we got to put you in bed, because he's in a chair kind of leaned over. And he wasn't sleeping. He had a little pencil, and he looked at me and he said, Sudoku. So I sort of bent at the waist, and I said, I too am Japanese. There was nobody there. I got no points for that.
Well, you did stand-up comedy, didn't you, at one time?
And as you can see, I didn't make a living.
No. Well, that, something, and I know a lot of people who really do love to do those puzzles. I'm still trying to figure it out. I don't think I will ever be able to.
Yeah, you kind of you need to do something you're interested in.
Yes.
But the biggest thing is learning new things and being socially engaged. That works.
That's great information. And what else, can you do for Alzheimer's patients now? Are there different types of medications? Are you, watching them on a consistent basis?
Yeah. So let me give you the Reader's Digest version.
Okay.
There's 4 medicines out there that have been FDA approved. All of them at some point in their development, I did the research, as did hundreds and thousands of people in North America and Europe. Mm-hmm. They're just no roaring hell. There's 2 culprits, and this I'm giving you the readers. This is the simplistic version of the latest version of the truth, the Disney version of the truth. So these 2 abnormal proteins are toxic to the brain. One's called amyloid, beta amyloid,
right,
and the other one's called tau, T-A-U. And so most of our research are new drugs that either stop amyloid from forming or dissolve it, or stop tau from forming or dissolve it, or stop it from moving. So in general terms, the medicines that we have out there, the Aricept, the Exelon, the pill and the patch, the Razodine, the Namenda, that's it. That's all we got. They don't do anything to amyloid. They don't do anything to tau. They try to keep a neurotransmitter that predominates in the short-term memory circuits up a little longer.
Oh, okay.
But the cells are degenerating. There's nothing to plug into. So you get a little bang for your buck early, and then after that, it's just marketing. So
gotcha.
Everybody and his cousin in the pharmaceutical world is trying to come up with a medication that works. Whoever wins will be the largest revenue-producing drug in the history of man. But till they win, we do research. And the research is at no cost. So if we find somebody who's a good candidate, they want to participate, and they have to have a study partner, then we can do, state-of-the-art workups. We can actually confirm that they have amyloid or tau in their brain, because there's new tracers.
Oh.
So we give a tracer, we take the picture, and the amyloid and the tau light up like light bulbs.
Wow.
And then we say, okay, we have a medication that stops the amyloid from forming or dissolves it, and we want people to stay stable, and with that we can actually see the amyloid and the tau levels go down.
Wow.
So if you think about Alzheimer's as a slowly progressive terminal brain cancer, which essentially it is.
Right.
And really from the time of diagnosis, 95% of people are dead in 8 to 10 years. If we can get people early, we can put them in remission and keep them where they're at and have a life, right? And so that's most
And their loved ones have a life as well.
Because I don't know if most people know this. Even when I started doing Alzheimer's, I didn't know this. 50% of the caregivers die before the patient. It's so stressful. My mother's going through this, and she's just literally falling apart.
Wow. I did not know that.
Yeah, so a lot of what we do is TLC and try to, make sure that the caregivers have some support. Just because it's so stressful, we talk about home health and when it's time for placement, because there's a time where you just can't manage.
Right. Exactly.
Yeah. It's having going through this personally is different than just being a doctor with other people.
Right.
You're empathetic. It hits home when you see your dad just kind of fading away to a shadow of himself.
Yes.
Yeah. It's a disease without dignity.
You're absolutely right. And what I really, do like about what you're doing is that, first of all, you're doing the research that's so necessary out there, but you have such a compassionate way about you. And so does your clinic. I mean, I was busy going through your website, which is Brain Matters.
I'll tell you about us. We're Brain Matters Research. We're at the corner of Lake Ida and Congress. It's a big 20,000 square foot building. We have about 12,000 square feet, and we've got a great staff. So we have another neurologist and a PA, and it's all about TLC. Right, spend as much time as it takes. And I know you're going to drop by, unless you forget, of course. But the way to get
I would love to drop by. Yes, absolutely.
So we're at 800 Northwest 17th Avenue, but that's the corner. And you can get a hold of us through the website, brainmattersresearch.com, or call us at 561-374-8461.
Say that one more time. Audience, get your pen and paper.
brainmattersresearch.com. That's easy. Or 561-374-8461.
Okay, great. Excellent. And you have also written the book. How do we go about purchasing the book?
You don't.
We don't.
Right. You come in and have a free screen, and I give you a book.
Oh, okay. Okay, great. And what's the name of the book?
It's called The Prevention of Aging, Stroke, and Alzheimer's.
Okay. And
but I'm changing the title.
You're changing the title.
Yeah. And it's called Brain Matters, and then that's the subtitle. Now I'm going to call it It Does Matter If You Don't Mind.
Oh, my God. That's fabulous.
Yeah, it's a little more catchy.
Okay. I'll come over and pick up a copy and go through that. I would love that.
Yeah, do a screening.
Well, thank you so much, Dr. Brody, for being here, for being part of our show this evening. Again, if you have any questions for Dr. Brody, you can always call Maddie at All County Healthcare, and that's 888-717-7170. And if you happen to be a doctor and would like to be on our show, please give Maddie a call as well. We would love to have you. Until then, it is time to say goodbye. Thank you very much for being a part of our show this evening, and we'll see you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those